Hey everyone, Josh here, and in this video we'll be discussing the different cardiovascular system medications you'll be responsible for knowing on your dental hygiene boards. So let's kick things off by talking about medications used to treat hypertension, first starting with ACE inhibitors. Angiotensin-Converting enzyme, or ACE, is an enzyme involved in the RAS pathway, responsible for catalyzing the conversion of angiotensin-1 to angiotensin-2, leading to vasoconstriction. This means that medications that block ACE, referred to as ACE inhibitors, will end up decreasing the amount of angiotensin-1 that gets converted to angiotensin-2. And because angiotensin-2 usually leads to vasoconstriction, inhibiting this pathway and decreasing the amount of angiotensin-2 will now lead to vasodilation and help decrease the blood pressure in a patient with hypertension. Now, one common example of an ACE inhibitor is lisinopril, and this is one that can actually cause dry cough, dry mouth, and loss of taste. So it's a good idea to remember these side effects in the context of dentistry. But inhibiting the ACE is not the only mechanism in which vasodilation can be achieved. Now, angiotensin-2 receptor blockers, or ARBs, are similarly used to treat hypertension, but instead of preventing the formation of angiotensin-2, ARBs directly block the action of angiotensin-2, preventing vasoconstriction, leading to vasodilation and lowering blood pressure. Some examples of ARBs are losartan and candesartan. And this brings us to our first practice problem. This question asks, what is the mechanism of action of candesartan? Now, I'll give you a minute to pause and think about your answer. So remember, we just mentioned that candesartan is an ARB, meaning it is an angiotensin-2 receptor blocker. So of course, the correct answer is going to be option C. It inhibits angiotensin-2. Now let's switch over to talk about beta blockers. Now, beta blockers are drugs that in general competitively inhibit beta-1 receptors in the heart, which reduces heart rate and contractility. But there are actually two types that you need to know about. First, we have selective beta-1 blockers, which only competitively inhibit beta-1 receptors in the heart, leading to a reduction in heart rate and contractility. Some examples of these are atenolol and metoprolol. And second, we have non-selective beta blockers, which actually competitively inhibit beta-1 receptors in the heart, as well as beta-2 receptors in the lungs. Now, two examples of non-selective beta blockers are propranolol and carvedilol. And it's important to note that carvedilol also dilates arteries, in addition to decreasing heart rate and contractility. Now let's move away from beta blockers and into diuretics. Diuretics are a class of medications that work by reducing the amount of fluid in the body, which ultimately helps lower blood pressure and ease the workload on the heart. Now, the actual mechanism of action can get pretty complicated, but all you need to know is that thiazide diuretics, such as hydrochlorothiazide, work by inhibiting sodium chloride symporters in the kidney, which reduces sodium and water reabsorption, leading to an increase in urine production. And remember, we want to increase urine production so we can reduce the amount of fluid in the body. Now, a couple important points that you need to know for the exam is that thiazide diuretics can actually lead to xerostomia, or dry mouth, and they can also lead to blood sodium and potassium loss. This is why a diuretic class called potassium-sparing diuretics can be used. The most important potassium-sparing diuretic to know is spironolactone. And lastly, a specific class of diuretics are the loop diuretics, which are the most potent as they work in the loop of Henle and block the transport of chloride, sodium, and potassium. In turn, this leads to no water absorption, leading to massive sodium, chloride, and water loss, making loop diuretics the most potent. And an important note is that since diuretics can decrease fluid in the body, they are commonly referred to by patients as a water pill, which may help students remember a bit better. Okay, with that, let's try our second practice problem. This question reads, each of the following is an effect of hydrochlorothiazide use except one. Which one is the exception? Now, I'll give you a minute to pause and think about your answer. So right off the bat, remember that hydrochlorothiazide works to decrease burden on the heart by decreasing the amount of fluid in the body, and it does this by increasing urine production, which makes option C, decrease urine production, the exception, so C is the correct answer. Now, although I didn't go into detail about options A and B, don't worry about those. What's most important is that urine production is increased, not decreased. Oh, and don't forget that thiazide diuretics can also cause xerostomia, so it leads to decreased salivary flow. Okay, now let's go back to drugs that act on the heart by going over calcium channel blockers. Calcium channel blockers, or CCBs, prevent calcium from entering cardiac cells, leading to vasodilation, reduced contractility, slowed heart rate, and decreased conduction at the AV node. Basically everything you'd want for a patient with hypertension or heart function disorders. However, the most important thing you need to know is that CCBs usually end with pene in their names, such as amlodipine or nifedipine, and also include verapamil. Another important point to note is that these medications can actually lead to gingival hyperplasia. This is important to remember. Okay, now let's go over cardiac glycosides, which are used to treat certain heart conditions. One example of a cardiac glycoside is digoxin, which is used to treat heart failure and arrhythmias. Digoxin acts by inhibiting sodium-potassium ATPase pumps in heart cells, which indirectly increases calcium levels in heart muscle cells, leading to stronger heart contractions. Another way digoxin acts is by increasing vagal tone, which slows conduction at the AV node, making it useful to slow down heart rate and control rapid heart rate. Now, there are a couple things to keep in mind with digoxin. Digoxin has a narrow therapeutic index, which means there's a high risk of toxicity. Additionally, in terms of drug interactions, tetracycline and erythromycin can increase digoxin levels, meaning an increase in toxicity risk. A precaution to remember is to limit epinephrine to cardiac dose. And lastly, some oral effects include increased salivation and increased gagging, which may interfere with dental impressions. Okay, and this leads us to our third practice problem. This problem reads, each of the following medications is known to lead to gingival hyperplasia except one. Which one is the exception? Now I'll give you a minute to pause and think about your answer. So here the correct answer is going to be option D, digoxin. Digoxin does not cause gingival hyperplasia, but amlodipine and nifedipine, which are calcium channel blockers, do lead to gingival hyperplasia. And the same can be said about phenytoin, which is sometimes sold as Dilantin. This drug can also cause gingival hyperplasia. Now let's switch gears and have a talk about nitrates. Nitrates are medications that help improve blood flow to the heart by relaxing and dilating blood vessels. One such nitrate medication is nitroglycerin, which is converted to nitric oxide and stimulates guanylyl cyclase. This increases the conversion of GTP to cyclic GMP, which then relaxes vascular smooth muscle and causes vasodilation, improving blood flow to the heart. Now, one important point to note is that erectile dysfunction medication, like Viagra, inhibits enzymes that break down cyclic GMP, meaning the use of nitrates at the same time as erectile dysfunction medication can cause very high levels of cyclic GMP, which can lead to extreme vasodilation and can cause dangerous, severe hypotension. Okay, now let's switch over to a talk about statins. Statins are medications prescribed to lower cholesterol levels in the blood, which in turn lowers the risk of heart disease and stroke. Now, the most important thing you need to know about statins is that they work by inhibiting the enzyme HMG-CoA reductase, which plays a key role in converting HMG-CoA to mevalonic acid, which then gets converted to cholesterol. So less mevalonic acid from the use of statins means less cholesterol. Now, one example of a statin that you may have heard of is Crestor, which is a type of rosuvastatin. And lastly, for patients using statins, it's important that they avoid grapefruit juice, since grapefruit juice contains compounds that reduce cytochrome P450 enzymes, which interferes with the breakdown of statins, leading to rhabdomyolysis, which is a type of muscle tissue breakdown. And this leads us into our last practice problem. In this question, we have a patient with the chief complaint that their mouth is hurting constantly. They have a history of hyperlipidemia, hypertension, and an angina, for which they're taking simvastatin, metoprolol, and amlodipine. Current findings from our exam are occlusal caries on teeth numbers 19 and 30, and the patient is diagnosed with periodontitis, stage 3, grade B. We're told during the exam, the patient begins to have crushing chest pain. The patient is given a nitroglycerin tablet sublingually. We're asked, what is the mechanism of action of the medication provided? Now I'll give you a minute to pause and think about your answer. Now we should remember that nitroglycerin is converted to nitric oxide, stimulating guanylyl cyclase and increasing the levels of cyclic GMP, which then relaxes vascular smooth muscle and causes vasodilation, making option A, activates guanylyl cyclase, the correct answer. Option B is tempting, but nitroglycerin increases cyclic GMP, not cyclic AMP. Option C, inhibits HMG-CoA reductase, is the mechanism of action for the patient's other medication, simvastatin. And lastly, option D, blocks calcium channels, is the mechanism of action of calcium channel blockers such as amlodipine and nifedipine, which, don't forget, also causes gingival hyperplasia. Alright guys, and with that in mind, we are done. As always, here's a summary slide with some of the high yield points that we went over in this video. Thanks for watching guys, and I'll see you next time.